Hello,
Hey dog, how you doing?
I'm doing great. How are you today?
I'm well, thanks for asking.
Great, great.
Well. Thanks. First of all, thanks for all you guys have been doing, man. I just don't know how does it feel, first of all, when you after a wait, how many hours do you guys work in one?
12 hours. So,
12,
yes,
12
usually about
exhausting hours.
12 exhausting hours. Yeah, usually it's from 7 to 7, usually.
Yeah?
Um, but, there are variations to the work hours, but for the most part, it's 7 to 7. So it's usually 12 hours.
12 hours. And then you get some rest, but you have to take us through this whole journey. First
Sure,
of all,
sure.
how you guys do it. Then we're going to talk about the kits if you have enough, and then what people can do to prevent themselves from getting infected with the COVID-19 and everything. Anyway, let me just start first because people are joining already. Hi guys, my name is Kola and I'm with Afrocentric Television Channel 15.8. I'm joined today with Dr. Adeomi. We call him Style Doctor because I mean he's one touche doctor. I don't know how he survived it every day, and his wife is definitely trying, coping with it. I'm sure. So today we're going to be talking about, the pandemic, the COVID-19, coronavirus, the disease itself. So I want you to give us a rundown, of, you know, first of all, how can one be infected with this disease?
Okay. So, first of all, thank you guys for having me on. And I see quite a number of my family and friends. I see my sister Tokes and quite a number of people on here. First of all, my name, as you said, is Dr. Adeshola Adewumi. I'm an attending physician in Georgia. I've been in practice for 13 years. I trained in North Connecticut, North Yale University. Um, I been an assistant professor at West Virginia University School of Medicine, William Memorial Hospital, and currently I am um, a hospitalist, internist, intensivist, working at Iberia Medical Center. So that's just a rundown of what I've done. And prior to medical school, I was a paramedic. I was involved in 9/11.
Oh wow.
Responded to that. So I've seen quite a number of things
And,
that have kind of shook us a little bit. Um, in general, coronavirus is not something new. It's something that we've always known for a long time.
really?
Yes. So there are several types of coronavirus, and I'm sure there are people that they've seen some movies and they felt like this is some kind of conspiracy because some movies
Hmm.
talked about coronavirus years ago. What they're not talking about is the fact that coronavirus has been in existence forever. Now, there's several types of coronavirus. There are about 7 types of them, and this is just one of the 7. So,
Wait, wait,
if you
wait, wait, wait,
guys,
wait. Hold on. There are 7 types of coronavirus,
that's correct.
and this is just one.
This is just one of them.
And this just one of it halted the whole world.
That's correct. And that's why it's
Hmm.
quite important to get the information out. Obviously, um, I'm sorry, the light is on me, so just
Nah,
give me
it's
one
fine.
second. Get the information out. Sorry. Okay. So, going back to the coronavirus. So, like I was saying, there's 7 of them. Years ago, we had one called SARS. I'm sure you guys heard about it if you remember it, which affected quite a number of people. There's one that's in the Middle East. It's called MERS, MERS, is a coronavirus. And there's several variations that also alpha coronavirus. So we've known about coronavirus for a long time. That's why if you look at your disinfectants at home, you see part of the the viruses and bacteria that they kill. Coronavirus is part of them.
Absolutely, like the
So
Lysol.
that's correct. So it's nothing new as far as the medical community is concerned. This is just a variation. Like we have variations in the influenza virus every year, and that's why most of the time you have to get another vaccine every year for the flu because there's always a variation in strain. And so this is just a novel one because it's not like the ones that we've seen before. And so we'll talk about that. If you guys have any questions in between, I'll answer that way, so we could. I don't have to ramble on just the coronavirus itself.
So you said seven types, and I guess the one that hit China, the very first one that came out in Wuhan, is
Mhm.
is different from the one we're experiencing now. Is it?
That's correct. So the one that came out of Wuhan is actually the one that we have now. It's different from the ones that we had before. Now, um, the one in Wuhan is what we have now. What happened was that there was some kind of transmission between a bat to an animal to a wet market to humans. So usually coronavirus are again in animals, in cats, bats, and they don't have any problems with them. Like we humans, we have bacteria that we carry around. This is a virus, which is a little different. So how it is, it was transmitted from either a bat into the live animal, which was sold in combination with at the wet market. It went into someone that transmitted into somebody else, and then it kind of went over all over the world with that. So with the transmission itself, for us, it's more respiratory as well as droplets. And so the other coronaviruses that have been available are not do not necessarily cross over from animals to humans, and that's why this is a little different as well because of the way it was transmitted to us.
Mm. So since it's respiratory, how far can one get to someone infected before you can be infected? And what are the various ways one can get infected?
Okay, great question. There are two ways of getting infected. So it's either you get it through the respiratory drop. Yeah, two ways. Either you get it through the respiratory way, where somebody's in front of you and they're talking to you less than 6 feet from you. So in talking and coughing to that person or towards that person, they can get it. Or if the person that's sick actually coughs and it drops, it's a droplet, and then you touch it, and then you somehow touch your face or touch any part of your mouth or nose, and then get it into your system that way. If the coronavirus is on the ground and you touch it, if you don't touch your face, you're not going to get the respiratory infection.
But
So
how
that's why
long
we
can it
always say,
stay on the ground on different surfaces? Let's say on plastic surface, on metal surface, on let's say on your clothes.
okay.
How long can it stay on there?
So they're varying research on that. So it depends on the temperature. So it does not do well with temperatures greater than 60 degrees. We could say 55 and up. So when it's cold, it stays longer, but the amount of time that it does stay alive is actually varying, and that's why again this is novel and there's a lot of research going on. But it stays on. It could be from 2 hours to 12 hours from the research that we've been having. So if it's very hot outside and it's there, it wouldn't last that long. It wouldn't last
Okay,
you two
so
hours
we're
at a time.
anticipating. Let's assume now it's summertime and it's the temperature is about 75, 80 degree
Hmm.
outside. Um, it can still survive it, but it just won't be as long as 12, 15 hours.
That's correct, and that's why we at this point are thinking we might get a reduction now. But when the weather changes a little bit and we get into fall and winter, it might come back because the weather is a little cooler. And that's where the discussion is now. That though we are opening things up and things are starting to decline, we might see another spike in the fall or winter.
So, but once it dies, let's say once it dies, does it resurrect?
No, no.
No.
So it's the bacteria does not it cannot survive outside of a human. So
Really?
once it dies, it's done. Yes, it needs a host to survive. So once it's completely done and it's killed, it doesn't come back.
It needs
So
a host to survive.
for example, if you have it on the surface in your house and you clean it up with disinfectants and stuff, it would not come back. It's done.
So, what would you advise? Okay, so a lot of times people still go out in the United States, right?
But
You don't know who had said something, who had coughed, who had sneezed. on that same path you were taking to get to where you're going, right? I guess that's why they say social distancing is very, very essential. However, you're
No, let
not
me let,
knowing
let,
what you
let,
want.
let me correct that. Social distancing is in effect because you're not sure who has it
Who
when you
has it?
are. It's not because they're walking over and they cough and it's there. The droplets are very heavy, so they don't stay in the air for too long. They just
For
kind
how
of
long
drop.
can they stay in the air, though?
Less than 30 seconds.
Oh,
Well,
really?
yes, they literally drop. You know, you cough and then they start to drop because it's so heavy. So they don't stay in the air and then you come in and then you walk into it. It's the fact that again you don't know who's sick and then they're right in front of you. So when they speak and they cough, you might get it, and that's why social distancing is quite
That
important.
being said, though, Doc, the shoes we wear, we still wear
Right.
them outside, and we probably have stepped on these viruses, right? And then
Hmm.
we walk into the house with them. Is it advisable to just keep your shoes outside, the same one you wear? You wore going out, you have to keep them outside before you come into your house, just to avoid
Yes.
being.
Yes. The simple answer to that is yes. I'll give you an example. If you walked in a hospital today, and say for example you went upstairs and you're coming out, there is disinfectants outside where you literally have to step into to go because obviously you may have stepped on particles with the virus in it. So because they don't know how long it'll last or stay on your shoes, it's advisable to put them outside, before you go in. For example, a person like me, before I go in, coming in from seeing patients, though I've done everything prior to coming in, literally have to take everything off before hugging the family or kissing them and all that stuff. So you literally have to take everything off outside in the garage before coming in.
Huh. So let's start now backwards now a little bit. Let's talk about what one can do. How can first of all, how can you identify someone that's infected?
Unfortunately, you cannot,
Hmm.
and that's why again
Okay.
the whole world is pretty much shut down.
Hmm.
We've had asymptomatic people walking around infecting others and not knowing. And you've had people who have been in the same room with someone that has coronavirus and they haven't gotten it or they didn't get it. So it's difficult, but what everyone that has coronavirus, even if it's mild, that they've had is some kind of symptom, either a fever, a cough, sore throat, and those things. Majority of the people get better without any intervention being done.
So
So someone
how
might
long can
feel
it stay in your system before it comes out, manifests?
so the incubation period is about 2 weeks, and that's where the whole 2 week stay at home thing came in from. So usually when you get in contact with someone that had the coronavirus,
Yeah.
it comes out within those 2 weeks, but it could be as short as 4 days, or it could be as high as 14 days. We've seen people show some symptoms in 2 days, but that's not common. So the usual time is about 4 to 5 days of you coming in contact with someone that had it and you exhibiting the symptoms of coronavirus.
Man, it's becoming scarier. But I know this is not about a show to scare anyone away. However, can you tell us the magnitude of this virus? How dangerous it is to human health?
Okay. Um, when we look back at other viruses that we've seen in the past and the numbers, you can say that this is not that terrible. Again, if you watch the news, you think that the whole world is dying. But if you look at the numbers per
That's what
se,
it looks like, man.
right? And when you look at the numbers per se, we've had more deaths from the common flu than we've had from the coronavirus. The problem that we have with coronavirus is that it's affecting everyone at the same time.
Okay, I was gonna say because
So
if you look at the flu spread from like years. So the
that's
number
correct.
you would start counting for years, but this within what 5 months they're about
No,
now.
not necessarily the flu counting for years. I mean, you could look at the flu from October till May or June, till May, and you see big numbers from the common flu. And every year, if you look at those numbers, they're very high. Again, the problem with this one is it's affecting a whole lot of people at the same time in different parts of the world. And so the resources are limited because of what you're getting or what you have to use. But when you look at the damage that the disease does to a person, it's quite scary, as you say, for a layman. One, it does a whole lot of inflammation in your body, so it can affect not just the lungs, because that's where it starts from. Then you can have it in your heart, you can have it in your kidneys. And so by the time that person gets into the ICU, when we see them and they intubated, their lungs look like somebody that's had something called fibrosis, which is like it's like scarring of your lungs, and
Mm.
that's why it becomes very difficult for people to get out of the ICU because of how much damage is done to the lungs. So this part of coronavirus does a whole lot, and we've known the kind of people that it affects. The hypertensives, the diabetics, the asthmatics, the lung disease patients, cancer patients, people that are compromised. Those are the people that it actually affects most. So part of the reason why I wanted to do this to enlighten everyone and let everyone know there's some things that you have to do health wise to avoid getting this and getting into trouble with it.
So, Doc, Dr. Jumoke, hi, Doc. Thanks for the question. She asked, she said, can you speak on the GI presentation on COVID-19 in some patients as opposed to having respiratory symptoms?
Very good question. I was actually just talking to one of my aunts yesterday, my sister yesterday, about a presentation of the patient. I'll give you a patient presentation, and I'll tie into what Dr. Zumake just asked. So basically, recently we've been seeing more GI symptoms. We've been telling people that if you have fever, cough, and
One
all these
question.
things,
Can you tell us, most of us are knowing the
I'm sorry.
technical
So
term, GI. What does that
GI
mean?
means the gastrointestinal tract. So anything that has to go from your mouth to your stomach to the rectum and out. So the GI symptoms include nausea, vomiting, diarrhea. Those are the GI
Nausea,
symptoms.
vomiting, diarrhea.
Right. Whereas respiratory is cough, shortness of breath, which is
Mm.
different. So what we've noticed from coronavirus initially was that a lot of people had the respiratory symptoms, which is the presenting illness. Will be the fever, the cough, sore throat, shortness of breath. Recently, we've been having people come in with nausea, vomiting, diarrhea. So let me go back to that patient that I talked about. So patient can be um, when you obviously with this day and age of coronavirus, everybody that comes in, you want to ask them a travel, the fever, the cough, the trouble breathing. So this lady, a 64-year-old person, no, yeah, 64-year-old person comes in and says, I haven't traveled anywhere, but yesterday I had some peanut butter and jelly, and I started vomiting. So a second-year medical student will tell you exactly what he thinks is going on. No other symptoms, no fever, no chills, nothing else. Ate some peanut butter jelly, came in with diarrhea. Diarrhea is not resolving, but just doesn't feel well enough to go home. So obviously had to be admitted into the hospital. While she's admitted into the hospital overnight, she said, I don't feel well. I don't feel well. Then she started having trouble breathing. So when I came in the morning, she was still having the stomach pain. Now it's on the right side. The right side, you think about the liver. So now she wasn't thought to have coronavirus. She go downstairs, had a CAT scan, shows that she had a stone in the stomach. As she's coming back upstairs, she continues to have trouble breathing to a point where she ended up in the ICU. Now, when you end up in the ICU and you get intubated, the first thing we want to know is, do you have coronavirus? Sure enough, we got her tested for it, and she does have coronavirus.
Hmm.
So she did
So, but the
not come.
symptoms look alike though,
The symptoms that she came in with was for nausea, vomiting, and diarrhea, which is completely different.
which is different.
So that's why, like what Dr. Jumoke just asked, is very vital. People, we all say, look for fever, look for chills, look for cough, trouble breathing, which is where it affects primarily. It's in the lungs. But we've been seeing variations to where you have nausea and vomiting as well as diarrhea.
So, Doc, we can't detect or we can't tell who's infected just by
Right.
mere looking at them, except they have those symptoms, right? We will talk about the symptoms, but what can one do to prevent oneself from getting infected?
The first thing we can do is to stay home. Stay home in an
Ah,
environment. I know. So stay home in an environment that you know is safe for you. That you know who's coming in and who's going out. That you know that somebody that's coming in is not coughing, they're not having any trouble breathing. They haven't had all these things that show signs of coronavirus. The other thing is you have to continue to wash your hands. We've known this for a long time. Soap and water works very well for everything. That's why we take a shower every day, because soap and water kind of cleans everything. So bacteria, the viruses, parasites, you get rid of them, just by maintaining good hygiene. The next thing is you have to also let people know that around you that when they are coughing, to not do it in their hands, but to do it in their elbow, like
right.
they transmit it there. It doesn't go to you or to the surface. So that's one of the things that we tell people now is to continue to do that. What I'm seeing so far around town is that they've been putting a whole lot of sanitizers around, which is something that's very good. So just continue to use those, and those things will help quite a bit.
How long does that wear? Does that take before it wears out?
What, the
The
sanitizers?
sanitizers, yeah.
Right away. It takes effect right away. The virus does not last with any kind of alcohol wipes. So as soon as you put it on, it's done. It's like using soap and water. They literally degrade the virus, so it's done completely. Now washing your hands is a little different. We want you to wash it for about 20 seconds,
And
just
why is
because
that?
when you do, sometimes what we tend to forget is that when we wash our hands, we go like this, right? So when you do this, what you're missing is the web sometimes. So if you count 20 seconds, that's a long time. So when you're doing this and you're counting, this is not even 5 seconds yet. You want to kind of put water in it. Now, if you're counting 20 seconds, you'll realize that you're not doing the back of your hand. And then you'll realize you're not doing the webs, the webs and then the palms as well. So that time itself makes you think about the rest of what you're doing as far as your hand is concerned. So you literally just doing that, and whatever is there, you're washing away with that time, and then you're giving the soap enough, surface to kind of work on, to kind of wash away.
So, someone asked earlier. Let me go back to it. He wants to know, once you get it once, can you get it again in the future, or is your body gonna be immune to it?
That's a
This
good
is talking
question.
about reinfection.
That's a great question too. And I also go back to what I'll talk about today. I'll relate it to the patients that we have, so that it will kind of make sense to you. When we get patients, we test them if they're positive for coronavirus coming in, especially when they have symptoms. Usually, when they say, for example, they have symptoms, I mean, they have mild symptoms, and you tell them to go home. You don't have to admit them. If they get admitted into the hospital, it's because their symptoms is more than mild. So when you come in, you get tested for coronavirus, and then you monitor it. Now, over time, especially some people that come in from a nursing home, they want you to retest them to see if they don't have the virus anymore. A lot of people don't have to go through that. Once you have the virus, you develop something called an antibody to it.
Antibodies, okay.
And once you have the antibody, that kind of protects you from getting it again. Now, going back to that question of reinfection, so we've had somebody that's done very well in the hospital, came in for coronavirus, was positive, and then 3 weeks later, still in the hospital, was about to be discharged, still getting positive again. Now the question is, have they been positive the whole time, or this is a new one from somewhere? Because there's different tests out there, it's kind of difficult to say. But if they're not exhibiting any kind of symptoms, we don't think that there's a reinfection. You've probably seen on CNN where they said somewhere in South Korea, people that had it, about 175 people had it before, and then they got retested and they were positive, though they weren't having symptoms. Now, what the test was not saying is this an antibody test that will say that this person had the virus or still has the virus, or is this a new infection in itself? And they haven't been able to prove that this is a new infection. So going by what we know from other viruses and bacteria, once you have an immunity, you're kind of safe from having it again. Now it could be like a flu where though you get the flu shot, the whole year, you have to get another one next year. But immunity is usually there for about 2 or 3 years, and then you're good. So we don't expect, as it is now, even though this is still evolving, we don't expect you to get a reinfection when you've gone through it and you've done better with it.
Fantastic. Thank you so much for that, Doc. Dr. Adams asked, what your recommendation of preventative medicine is.
Preventive medicine. Okay, so well, we always, I mean, I love this preventive medicine because that's where everything starts from. When it's better for you to prevent things than to treat things. So it's like you're behind the eight ball when you're trying to catch up to something, to treat, rather than actually blocking it from coming in. So what we talked about before, obviously, is again good hygiene, wash your hands, kind of be aware of where you are, who's sick, who's not, who's coughing. Even when everybody goes back to work and people use spaces as far as computers concerned, we might all get to a point where we have to wipe everything down all the time now because you're not sure who was there, who had it in their hand, who was typing on there. The other thing is the use of vitamin C. We've known this for a long time. We've noticed from drinking some apple juice, from oranges to lemon, all those things.
Because of the
Those things,
acidic level.
they just kind of help boost your immune system, pretty much. And so if your immune system is up to par, you're less likely, or you're more likely to have the mild symptoms than to get into trouble with, severe symptoms. So I would just say continue to, stay healthy as far as preventive medicine is concerned. Make sure your blood pressure is well controlled, which again, it seems that blood pressure and the use of some other medications might also be implicated in coronavirus complications. But we'll talk about that if we have time. But make sure that your blood pressure is well controlled, your sugar is well controlled, your weight is well controlled, your asthma is well controlled, because again, this is more respiratory than anything else. And also make sure you continue to, do the good hygiene, which is continue to wash your hands.
Well, talking about that, Lolly Bay asked if it is necessary to get the antibody tested.
It's actually good. I think a lot of the hospitals are doing that now because it makes things a little bit easier for you to know who's gotten it and who has an immunity to it. So for people that don't know what an antibody test is a test that looks at several things to see if you're currently infected or you've had it. So what they're looking for is something called IgM, which is going to tell you that a person has something going on now as far as that virus is concerned, or the IgG, which tells you that the person had it and they've gone over it and they're okay with it. Some people might not know they even had it. So when you do the test, you say, okay, you know what, you have the IgG, you went through it, you didn't even know that you had any diseases, and you're done. So you're good to go about your business. And that's why that's good. So for people in the hospital, it's good for us to know this doctor's had the IgG, this person has the IgG, and they're not infected and they're not infecting patients coming in. So it's good to have it for yourself, but it doesn't necessarily do anything as far as other people are concerned. Because again, if they have it, it's going to be on them. It's not going to be on you because you're not going to get it. Yeah.
Gotcha. So, Dr. Jumoke asked, what would you recommend to people with underlying medical conditions since they are higher risk of getting the virus?
My my recommendation to them is to minimize their contact.
Is
I
what?
know to minimize their contact. It's very difficult um, to have people not come to see you or talk to them. That's why we have an outbreak in the nursing homes because they are just older people. They're compromised or they have all these issues going on before. They're not moving as much. Somebody who's a CNA, a doctor, a nurse goes outside, comes back in, infects them. They don't know that they have anything, and that group becomes this, the infecting agent. So now those groups will have their own family coming to visit them, and then they'll kind of spread it out. So my advice is to kind of limit who you see and who you interact with. If you're speaking with people, like that's why I think that our lives are going to change now. The way we do things. because when you talk to people now, you want to give them some space. You wanted to, when they're talking, you might have to face the other way so that they're not talking directly into your face. When they're coughing, you move back a little bit, that kind of thing. So it's just a matter of just being cautious of who's around you and who you're interacting with and who's sick. We always tell people, either from going to school, coming to the hospital to visit people, if you're sick, just stay home. Even if you had the flu, we'd say if you're feeling sick, just stay home, because you can still infect other people with various other things that you have that you don't know you're infecting people with.
Wow. Thanks for that explanation, Doc. Um, I know I am okay. I am okay. Said, what is the average lifespan of the virus on surfaces? I know we discussed it, but I guess she just joined us. Does
Right.
heat kill the virus? And I
Yes.
guess you said yes, but it will still be there, but it just won't last as long as it would when it's cold, right? Um, Dr. Jumoke,
I could,
thanks
I
once
could,
again
I
for
could,
this
I could,
question.
I could explain a little bit better to her. So, what I said before, see, I think you were just joining us, and thank you for joining. Surfaces it lasts between 2 hours to it could be 12 hours to 24 hours. Um, One of the things that people have always had issues with or concerns about is deliveries. My delivery is coming from China. How long does it stay on the surface? Should I worry about it? I guess, because we're rightfully doing that now because the research is still going on, is that it doesn't last that long. Now, if somebody coughs now, say for example, I'm affected and I cough now and I'm coughing the surface here, it will only last as long as the room temperature is below a certain amount. So anything greater than 55 or 60 degrees in the heat will kill it very quickly. And it needs a surface, it needs a host to continue to replicate. So when it stays on the surface for that number of time and doesn't have any host, it's gonna die. It's not gonna be there. And once you wipe it with soap and water, once you wipe it with disinfectants, it completely dies, and you don't have to worry about it.
Yeah, let me ask further to what Amoka just asked you, right? I know our time is fast spent. I know we said about 20, 30 minutes, but this is getting interesting and people are learning, and I'm learning also. So, if people wear gloves everywhere, they wear face masks. We still have to talk about that because that's the first thing people reach out to, believing that's going to prevent them from getting anything. Can you please touch on that? And also the packages, the mail we pick up from our mailboxes. Once we pick those up, what we do naturally is my wife just sprays them down with disinfectants, right? Before we even try to open them, right? So and I think that's a great way to prevent stuff. But for people wearing gloves, you've touched something while you're in the grocery store, while you're somewhere, and yet again you reach out to your phone with the same gloves on. I mean, can you please talk about that?
So before we started this program tonight, I said I was going to do a research with us talking
Yeah.
and you not knowing, and then because that's how research happens. We, especially with medications and stuff, you want to see, you randomize people and you say you get this and you get this, and then you look at the result. So my research tonight was that I will talk to you and I will see how many times you touched your face.
I have touched my face a billion times
That's
while
the
we're
point,
here
right?
talking.
So
And it's because I
and
washed my hand just before I joined.
it's
I
not.
just
It's not
did.
even that. It's not even that. So that's why it was a research for me to see how many times while we're talking live, to see how many
Mm,
times you touch your face, even though you're doing it now. People do that unconsciously.
unconsciously, yeah.
So we are humans, and we wipe our heads, we wipe our face, we sneeze, we something's itchy. We do that all the time. Now people wear gloves because they feel like that protects them from other things, right? So when you wear the gloves, you're going around. You have that glove. You have a false sense of security in your hand, thinking you're protected. So you have that glove going all the way around. You're taking the food. You're taking this. You're taking the cart, and all of those things. And then you put the cart away. Like you say, you rightfully take your phone. You just transmitted it from there, and you put that phone on your clothes, or you put it on the table, one of those things.
On
So
your
you
bed.
transmitted it. So unless you use a glove and you dispose it right away, it doesn't make any sense. So again, the only thing that you can do is whenever you touch anything, have the disinfectant, have the hand sanitizer, have the soap and water. That's better. When people have that, they have a false sense of security. So they literally just touch everything and they don't feel like and then they use those same gloves to either open the door of the car or get in the
I
car, and
know
then
we're trying to recycle.
when you take them off, you put them on the ground or on your carpet. And so literally you just kind of transferring them. But when you know you don't have any gloves in your hand, you have that feeling that I have to wash my hands. You have that feeling of I need to clean my hand right now because I don't know what's in there. So you become a little more obsessive washing your hands because you didn't have anything in your hand
Like we
versus
are now, man. We just on anything. You just want to get to the kitchen, get to the bathroom, just quickly. Some soap. Just wash your hands quickly before anything. That's awesome. That's on Joe. That's in Joe. Something. It says hi, Doc. Can one get this virus from blood transfusion?
No. And that's also very good. That's a great question. One of the questions somebody asked me today is, can you get it from blood or can you get it from feces? Like people in, nursing homes changing, older people,
Like
or you have a child.
once they excrete, they can get
No,
it
no,
from
no, no, no,
that.
no. No, no, the feces from, cleaning someone, from when somebody moves the bowels.
Right.
Like you get it from there. So people work where they change diapers and they change people.
Right.
Can you get it
Right.
from
Nursing
there?
homes and
It's very,
caregivers and
very
stuff.
no, it's very, very, very low probability that you're gonna do that. So you're not gonna get it from blood transfusions. Neither are you gonna get it from feces. Very, very low. It's more of a respiratory uh, symptoms. Now again, the reason why is when the coronavirus gets into your lungs, it kind of attaches, and it needs that to kind of survive. And so it continues to stay in that system before it causes all the inflammations in your body, the whole of your body. And then when you cough and you kind of bring it out, is when it actually gets into the other person. It's not because you know, they're touching it and then they put in it. Obviously they put it in their mouth. So to get it. So you're not going to get it from just blood transfusions. It hasn't been shown that that in the blood that there's something in there to kind of help hold it. So it needs the surface to kind of attach to. So let's put it this: so the virus is like it's round and it has spikes on it,
Hmm.
and the spike on it is what the corner is. It's like a crown on it. So that spike needs something to kind of attach to for it to kind of replicate, because inside of the virus itself has the DNA or the RNA to replicate. So when it attaches to that is when it kind of continues to do its thing. So the blood has not been shown to have that kind of attachment to it. So that would be very low for you to have from blood.
So the next one is from Dr. Jumoke, and she said to speak on the use of naturopathics such as garlic, ginger, things, and stuff to us, and of course, good diet to increase natural immunity.
Right. So anything that would boost your immune system is what we recommend. Again, eating good. There's so many things out there: turmeric, garlic, ginger, things that would just kind of help bring your blood pressure down. Because again, what we're talking about here is you're having predisposing factors to it. Existing conditions, high blood pressure, diabetes, lung disease, all those things. So when you eat all this natural stuff, it helps you bring your blood pressure down. It helps your respiration better. So any of those things will actually works well. Of course, as a regular doctor, we don't necessarily recommend certain things. We just recommend just eat, very well. With good diet, and that should be good enough.
So what are your takes on the vitamins?
Vitamins are vitamins are big business in the United States, all around the world. People like taking vitamins. They overtake vitamins. We actually have people overdosing on vitamins.
Talking
That
about
happens.
overtake, we need to talk on that.
So
Um,
vitamins are good. What I say is, and I think I've spoken about this before. Once a day, multivitamins. If you look at your multivitamins, actually, we don't have one here. When you turn them around and you look at the amount that you have, it's quite enough. So overdoing them is when you have too much vitamin A in your system, or too much vitamin D in your system, even though your body has a way of getting rid of them, of most of this stuff. Once a day, or 2 times a day is fine. So those are good to kind of help. A lot of us don't eat well. The doctors will tell you, we're on the run, and so you get what you can. So those vitamins kind of supplement, which is literally the name of it, is supplementing what you're missing to kind of help push your immune system as well as your the well-being. So vitamins are very good.
So, which of the vitamins would you recommend? Well, let me not use the word recommend. Would you advise that one keeps in one shelf?
One that's been in existence for a long time and is very good is Centrum. If you look at Centrum, they've made them in different. They even have Centrum 50 and over. They have different ones, but Centrum has been in existence for a long time and they're very good. I personally use GNC brand. It's not because of anything else, it's because I just like them. And, I like the way that I can take them and then go about my business. But once a day multivitamins are very good. It doesn't matter which one, as long as you take one, it's fine.
Does any of these weaken one's immune system? That means
Not,
if I mean what I meant is if you're taking, let's say you're taking vitamin B complex, you're taking vitamin C, and you're taking vitamin D, and then you start noticing your urine becomes more yellow
yellow.
in
Okay.
color.
So no, that is actually part of.
You're laughing, but it's
No, 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 no,
true.
no. I'm laughing because this is common. It's a common knowledge and it's something that people ask all the time. So I'm laughing because I was expecting that question. It's normal for your urine to be brighter yellow when you take the vitamins because again
Okay,
you
why is
get all
that?
this. So some of the particles that you take in, remember when you eat, they're broken down into different particles. And
Hmm.
one of the particles that actually comes out actually when it goes into your filter, which is your urine, your kidneys, they actually change colors into bright yellow. So it's not because you're taking too much. It's because of the breakdown that's coming out that should be seen.
So there's been word out there that if you take any of these drinks, let's say you add ginger, you drink or you take some oranges or whatever, drink orange juice or whatnot, because of the level of acidity in them, that it helps you, suppress the virus in your throat, if any, or whatever. And people tend to take it like in the morning, in the next 2 hours, they'll take another. And what can you say to that? We need education on this one.
No, those things are overkill, and they've not been proven. Um, Somebody said I was watching a video that was sent to me yesterday. Somebody said I have a package of medicines that I use in Nigeria for malaria. It's not the chloroquine, it's something else. And it says, "Oh, I use that 3 times a day, and my symptoms went away." That's not been proven. That just means that your body just kind of reacted to it and you got better. Anti-malarials don't work for coronavirus. Malaria is a parasite.
Mm,
Antibodies don't work for coronavirus. They're not bacteria. So this
interesting.
notion that you use these things to, and they work, it's not. It's your body does have a very good defensive mechanism. It works very well. Some people, again, their defensive mechanism is lower, so they're not able to mount that attack. But using all these things does not necessarily do much. Our body itself, the acidity in your stomach is very, very high. If you put your hand in your stomach right now, it will burn. That's how acidic it is. So, thinking that, when, the virus goes into your stomach and then you have to put some acid in it to kind of break it, the acid in your stomach is very, very high. So you don't need, the ones that you're drinking is not as high as the acid in your stomach. So that's not, necessarily something I agree with. But again, whatever works for you psychologically, it might be that the placebo effect that you take something and you feel like something is working and it's actually not
Yeah.
doing anything. It's like somebody coming in for a cold and they want you to give them some antibiotics. You know that it's not going to work, but they want the antibiotics. As soon as they start taking it, they'll tell you they feel better. You know that that's not it. It's because it's a viral infection. It's not a bacterial infection. But psychologically, people feel better because you give them something and they're doing better.
So, do you think it's right for us to go back to work now? I mean, working from home isn't. I mean, some of us are enjoying it, some of us are not. Some of us are bored already, but people want to get out there. But what would be your advice to and for people that are willing to just get out there to do? I know state parks are being open now. People are getting out there. And I'm glad you did mention that. Once the virus leaves your body, it drops, right? And that's a good thing to know because we felt like it stays in the air for like 1 minute or two. So even if someone coughs right now, if a minute later I walk past that person, I can still catch something.
No, it's
We
heavy.
just we
Body
need to be
closer are
educated,
heavy.
right?
Right.
So please.
It's understandable because at the end of the day, when something is novel and we just learning about it, we tend to take all the precautions. We say don't touch anything, don't let anybody touch you. Ebola is more deadly. Was more deadly than this.
Mm,
So, but we didn't. The whole world didn't close down because it was kind of regional. So, but if you have to come in contact with someone with Ebola, you're gonna get it. It's not a rescue. It's not just a respiratory. But this here, obviously, because people move around and you're coughing, you'll worry about how long it stays. But then with the research, we know that it doesn't stay that long. But for you to get an Ebola, you literally have to come in contact with that person, and that's more deadly. So as far as staying at home, I live in a state, Georgia, where governor.
well, I was gonna say your governor is leaving
Yeah, I wish our governor
that
was
open for everybody now, so I don't know how you're going to survive that.
yeah, I'm against politics of things, but I would advise people if you don't have to be outside on Friday or next Monday, stay at home. There are some people within those 14 days that are still not showing symptoms yet. Even though we've had this lockdown in Georgia for about 2 weeks now, it's still people are still walking around. People are still doing their things here. So there are people that they may have been shedding the virus in different places as well. And so just putting everybody out there at the same time is just setting us up for failure because what we're going to see is a spike in admissions again. Now we're not saying that we're going to completely eradicate coronavirus. It's not going to be any. We just want them to come in to trickle in. We don't want everybody to come in with the same symptoms. Now that's why it's become heavy in the system. It's because everybody's having it at the same time. So we don't expect that by tomorrow the numbers are going to be zero. But let it come down to a point where we know that if somebody has it and they give it to somebody else, it's not going to overwhelm our system. So I would say that for now just have them stay home. If you can work from home, if it's physical, I know that people are hurting. People need to work. People need to make money. But your health is also important. Again, a lot of people will have mild symptoms. You and I might have mild symptoms. The people that's on with us tonight might have mild symptoms and then not worry about it. The ones that we worry about is the people that you work with. That when you have mild symptoms and you get it from you, their immune system is not as strong as might not be as strong as you, and then it might cause a fatal thing for them to a point where they don't survive it. That's why the 14 days, even though we've got past it, and we feel like whoever's had the symptoms should have manifested or at least shown it by now. There's still one that the numbers are not coming down completely, and so we're kind of wary. Right now, you can't visit anybody in the hospital, because we still don't know.
It's understandable.
So,
It's understandable.
but even if the governor opens it tomorrow, we're still not going to let you in the hospital, to visit. And so I would advise people if you can stay home till the middle of next month. That's what I say. Again, people are hurting. I can't tell people how to work or how to make money. But that's the only advice I can say. Just look at the numbers. It's hard to look at the news because it's all bad news all the time. But just look at the trend. We see New York is coming down. The admissions are coming down, death rates is coming down, those things. But they gradually starting to do things. So, and they have the most numbers. And so we have to kind of tread with caution in this one. Just let it die down a little bit more before you go out.
Fantastic. Thank you so much, Doc. Um, I know we said 15, 20 minutes. We're already here about 45 minutes. Almost. But we'll take one last one, and then we can round up, and so I can let you get back to business and spend time with your family. I know you've been away from them for however long now,
That's
and
fine.
you're about to leave again. I don't know how you do it, and that brings me to the last question. Also, people with children or that work with children, how do you work with them without getting them infected or you getting infected?
Right.
Because I understand that the immunity for children is usually higher than that of adults or whatever. But if you're working with them, how do you? And then you coming back from work, coming to your family, knowing that you have children, how do you do it?
Okay,
Close it
so
on with an advice for us so we can
right.
come back because we
So
need to get you back on so we can talk some more about this.
oh well,
It's
yeah,
still
absolutely.
on.
It'll be my pleasure to come back. So my personal thing, which I spoke to my wife about, was just kind of, even though it's kind of hard, is staying away for that time that I'm actually at the hospital. So, for example, I came back yesterday, but my last day of working was on Monday. So obviously, I didn't want to come home and then still have. Obviously, my daughter is all over me, so she wouldn't let me get out of the car before she comes to hug me. So what I needed to do was kind of make sure that whatever it is that I wore in the hospital was not on me. So I stayed in the hotel, and then obviously took that, slept there, took a shower, make sure that everything that I had was washed. And so by the time I came in, it was fine. Now, what's my concern, especially facing this every day and having kids? My concern is not me. Like I said, she's just nodding. My concern is not me getting sick. My concern is getting them sick. And so what I've been doing is making sure that even though I'm not getting sick, when we get tested, not get tested, we get the temperature checks every day at work, is make sure that when I get back in, I take a hot shower all the time. I do the hot mist in my face. Wash everything over and over again, and just making sure that I'm not in their face all the time.
Mm.
Again, my daughter's all over me all the time, so I
I
just have to
know, I know.
make
So
sure. So it's kind of difficult because she doesn't understand that. Or just she just sees it like you
you just
pushing
want
them
to
away,
hold
but
that
you're not
back.
pushing them away. So it's if you don't have to be out there to get yourself exposed, so you don't give it to the kids, don't do that. But if you have to, you just have to be mindful of how you interact with them to a point where you're not just in their face all the time. So it's not there's no real advice for people with kids on the fact that keep them protected. I know that our school system, she's in the private school, and they were open for quite some time until they closed several weeks ago. What happened was that they would say, just drop your kids here, and then in the front of the school, and then pick them up. But what if I've infected my kid, and then they go on and infect other kids? And we know some kids are not as immune. I mean, their immune system is not that great. So I will still keep them in the house. The summer's coming. Keep them for as long as we can. To do that, some people cannot do that. Some people literally have to go back to work and have the kids in school. Just continue to do the hygiene. Again, this is not something we control. This is an enemy that we don't have a hold of yet. So we just have to continue to do what we can personally, and then trust people to do what they're supposed to, if that makes any sense. So
It does.
we can only do our part. That's it.
Thank you so much. So, someone asked, "How are you holding up, Doc? You've talked to us, you've educated us, you treat us, you're getting people saved. But how about you? How are you holding up?"
Um, I'm doing okay. The joy of it is knowing that people can see what you do now. A lot of the times that we've been doing this for some time. This disease is not the deadliest we've seen, but people don't know about them. And so, the most of the things that we get the most in the hospital is the family wants to know why they're not getting better. You're getting yelled at. They feel like you're not doing some things. But in this case, everybody understands what you do now and how hard it is. We do our best, but some people get better and some people don't. Um, how am I holding up?
Unfortunately.
I just, I'm glad to have a family that, is all over me. So that kind of makes things a little bit better. It gets very difficult. Emotionally, it gets very, very difficult. I had a 41-year-old that died. She's younger than me. So how do you relate? You have to literally leave that and go to the next one. And so emotionally, sometimes it's draining. That's why a lot of doctors burn out. And I think I spoke about that before. And when you have a family, brothers, sisters, family, wife, that cares for you and make sure that you're okay. That's usually what we need. So for me, I have that system. So I'm on the phone with my sisters and brothers. I'm on the phone with them. So that keeps me going. And then when you know that people are praying for you and they tell you all the time, that in itself is because a lot of us what we have is
I know for sure that I do that. You know, every once in a while, I just check up on you, say, "Hey, doc,
absolutely.
how you doing? We keep you in our
So
prayers, you know."
our faith is is very important most of the time that we just hold on to that because most of the time you don't know how the patient is going to get better or you just do your best and they do so or they don't and it weighs on you especially when you have younger ones that you've seen dying and you wonder why that's happening. So I've, the support system is very good. I love working out, so when I have that time I just go and just do my thing. But that's about it.
Awesome, awesome. Thank you so very much, Doc. I'm sure we will be reaching back out to you to
Sure,
come back once this whole thing, maybe in another week or two, whenever you're free. Just hit
sure,
me
sir.
up, let me know, and we can set this up again so we can talk to people and educate us. Keep guiding us. Keep our blessings, our prayers goes on to you
Thank
and
you.
your family and all the health practitioners, all the essential workers out there that's helping us, from the medical practitioners to the to the people handing our mail and stuff like that. You know, we just want to say thank you to you guys. I appreciate you, man. I know we've taken like twice the time we promised,
It's
but
okay.
it's worth it. And I thank you so very much.
Absolutely, and I personally want to take this opportunity to thank each and everyone. Again, whoever's watching today. But more importantly, in the hospitals, we always talk about the doctors and nurses. But there's some people that actually see these things and they actually touch these things that we're not talking about. The cleaners, they are in these
Oh
homes all the
yes,
time.
yes.
The
The
transporters,
cleaners.
they're in the faces of these patients all the time, and transporting them and talking to them and assuring them. Those people are actually vital to us as well. So whoever it is that's watching us, I personally appreciate you guys. You make my life easier. Um, thank you so much.
All right, Doc. I'll reach out to you on on another level.
Sure.
Thank you much.
Alrighty. Thank you.